It's now changed to Division Town Hall meeting. And in a change up because of scheduling, those of you who normally come to the 4 o'clock meeting are going first instead of having to hear from your coworkers earlier in the day. We'll also have the main day meeting tomorrow morning, and I'll be meeting with the people on Graveyard tonight. We've changed it up from our normal division meeting to a town hall to be consistent with the rest of the organizations across campus during this time period. We felt that it was very important, as a leadership team, we felt it was very important that we all connect and share information with our teams. And it just happened that we had our division meeting set up today, so we co-opted it into a town hall. I'm going to go off script a little bit from what we've done in the past. Normally, we've taken a lot of time to recognize new individuals to the team, recognize and celebrate our successes, talk about where we're going as a division, and have some general university overviews. But in the interest of time today, I'm going to briefly talk about a few things and then leave most of the time available for you all to ask questions. Now, this is a new format for us, and I'm really sorry that we can't all be together in the same room. You all actually give me a lot of energy when we have these meetings. I really enjoy them. I enjoy answering your questions. I enjoy interacting with you, seeing your faces in the audience as we talk about things. And so this is just a new environment, just a new normal at this point in time for me and for all of us. Joining us from Marketing Communications is Jenny Larimore, and Jenny will be serving as our moderator for this town hall. And she will give you, or maybe I should just turn it over to her for her to give instructions on how we're going to interact once we get to the Q&A period. Go ahead, Jenny, do you want to share?
Absolutely. Thanks, Glenn. Okay, so in order to submit a question, since there are so many of us on here, we just reached 101, which is awesome. What you'll do is you'll hover over the video and you'll see a number of icons at the bottom of your video screen. And if you click on chat, you'll see the chat feature open up to the right. I'm going to send everyone a chat right now with some directions. And for anybody who comes in a little bit late, if you're going to submit a question and you want to submit it anonymously, you can. What you'll do is go to that blue drop down button and choose my name, Jenny Larimore, and then you'll know that you've got just me on the chat when it says Jenny Larimore and then in red privately. So that is how you can submit a question anonymously. You're also welcome to chat everyone in the group at any point or ask questions to everyone as well. You can write to me directly if you have any questions at all about the process or anything else. And then we are also recording this town hall meeting as well as all the other ones for anyone who is unable to be with us at this session. So in order to look at any of the other town hall archived videos, you just go to isu.edu/town hall, and I'll include that in the chat right now as well. Thanks, Glenn.
You would think I figured out mute and unmute after doing this for a month, but I still forget at times. Thank you very much, Jenny. In addition, today we're going to be joined, I believe, by Dr. Rex Force and from the Division of Health Sciences, and our Chief Medical Officer on campus of Dr. Solbrig, and so that they can give us an update as well about where this is going from a medical perspective, and hopefully can answer some of the questions you may have. You do not need to wait until the question and answer period to submit questions. Jenny will start to compile those. If you have a question as we're going through the slides at the beginning, or you have questions right now, you can start typing those in, and you don't need to necessarily wait. Next slide, please. As we have talked about and started each of our previous division meetings, we've always gone back and looked at who we are as Bengals. We've talked about our culture in different ways of trust, compassion, stability, and hope. And I am just awestruck by the amount of effort all of our division, all 320 plus of our employees are putting forth during this time. We have a large number of employees who are figuring out how to work in a new environment, how to work from home, how to do these Zoom meetings, how to do more work by email, and not having that face-to-face interaction that we're so used to having every day. And at the same time, we have another large portion of our division, probably 25 to 30%, that are still working on campus. Yes, our buildings are closed to the public, but no, our campus is not closed. And so the number of people we have from facilities and IT in particular, those two areas that are keeping the campus functioning, and public safety, keeping the campus safe. Um, all of you are banding together at this time, and while it is a frustrating time, it is a new time for all of us. I think that we're grasping onto the hope, we're grasping onto the future, and that our job is to do the things behind the scenes so that students can continue to learn, faculty continue to teach and research, and we are here for the students, whether they are here or not. They are here online if they aren't here in person. So I just want to thank everyone for your efforts over since we met last time, but particularly since the pandemic has caused us to change the way we're working. So as we go forward, I guess let's go back one. I'm sorry. One of the other things I want to talk about in terms of culture, I've been on a few town halls with the provost, Dr. Woodworth Nye, and as some of you may know, and some of you may not, she is a historian. That is her field of academic expertise. And she's been sharing some stories in the academic side that I think are particularly important for us to listen to. This is a frustrating time. This is a challenge to all of us, our families, to our country, and to the world. Our generation has been lucky in that we have not suffered under a global disruption like this. But we're not the first generation to have this happen to us. If we go back to World War II, she has cited a number of stories and cited World War II as an example of where the entire world was disrupted. And if you think about even Americans, where we were, you had people continuing to get through the day-to-day activities in their new normal with their husbands, their sons, sometimes daughters, away serving in the military, either in the European theater or the Pacific theater, not knowing if that family member was going to come back, not knowing what life was going to be like when they come back. And I know from my own experience, listening to my mother grow up, as I was growing up, she and my aunt talked about how their father was I think he was probably 34 or 35. He was drafted into the Army and served in World War II. And he was away from home for several years while they were little girls. And their mother led the family and kept things going. And then the readjustment they had to go through when they came back. So we're not the first generation. And I think the lesson from that is they all responded. They responded well. They came back. They didn't know when they were going to come back. They didn't know when the economy was going to be bounced back, but people banded together. And I think that as an ISU community, again, going back to compassion, caring for each other, stability, continuing to work, continuing to make sure our students have a safe environment, whether it's online, whether it's the few students who do come to campus, all of our cultural aspects rooted in trust, compassion, stability, and hope will come to bear. And I think will make us a stronger unit. So next slide, please. I want to briefly touch on the budget, the FY budget, the 21 development process. We will then talk about the status of the CEC, and then we will move into talking about some of the budgetary impacts from COVID. In terms of the FY20 budget, where we are right now, we began the year, as I've talked about in previous meetings, with a $6 million planned deficit, meaning we would spend $6 million more than the revenue that we generated. The state board was aware of that. The legislature was aware of that. And we put ourselves on a path to erase this deficit over the next few years. Unfortunately, this year, as we discussed earlier in January, I believe, when fall enrollments came in, they were less than what we expected. And so we had a $3 or $3.5 million revenue shortfall added to that $6 million. In addition, the governor asked us to remit 1% of our state appropriation, which is between $800,000 and $1 million. And so we had to cover that. That moved our deficit this year to the range of $9 to $10 million, not the 6 that we were looking for. So in the meantime, we've now encountered the COVID pandemic, and we've lost revenue from events that were going to be held at Holt, such as Chrome in the Dome, which was a large revenue generator in the spring. And we've had to cancel several other large events from a revenue perspective. On the expense side, we had to, we've incurred additional expenses related to IT and to give us additional bandwidth, as well as facilities expenses. So our FY20 budget doesn't look really good right now. We do have some savings from travel. We have some savings from utilities related to COVID, but overall, we're still in that $9 to $10 million deficit range. And then on top of it, the governor has asked us to remit another 1% by the end of this fiscal year, which is another $1 million. So our current year, we're not starting in the best place. If we then move to our FY21 budget development process, if we assume we have the same revenues next year as this year, and we have the same expenditure levels as we do this year, we'll start the year off with about a $10 million deficit. Well, in addition, the governor asked us and reduced our budget by 2% for next year. So that means our 10 million goes to 12 million. So we have gone through we started a process of, actually we started a process a month ago. We asked Leadership Council, the deans and department heads, to relook at their budgets and tell us realistically what could they cut for next year. And it wasn't just to cut budgets, it was to make strategic changes. Could we look at our budget and change part of our organizational structure? Could we become more efficient? As we've talked in the past, DocuSign was an example of a product we could use to become more efficient by decreasing the number of forms that we send around campus. And now let's ask people, can we implement it faster? Are there other ideas you have to become more efficient that you were thinking of doing a pilot and you might be waiting for a while, or you would do a pilot and then let's evaluate it before we decide to roll it out? We're saying, should we do those things now and be faster? So this week, we started budget hearings or budget meetings with Leadership Council. I've spent the last 2 days, 2 half days, in meetings listening to proposals from each unit across campus to adjust their budget for next year. Everyone has stepped up to the table, not just the academic side or the administrative side, but all of us have put forth ideas. And hopefully your managers have asked you for some input during this process for ways you could operate more efficiently. Unfortunately, that solves our budget deficit problem that we talked about spending 2 or 3 years to do. Unfortunately, however, COVID-19 has added other factors to us. We have the lost revenue from events we don't have. If we can't hold summer camps this summer, we lose that revenue. That's a significant amount of revenue, but beyond revenue, that's exposure of potential students to our campus. We had to cancel our spring visit days, and so that is potentially impacting our fall enrollment. But next year, we have a $5 million holdback that goes back to the state on top of the budget scenario I just mentioned to you. We have some additional expenses and we have revenue shortfalls, and we're not sure of what the impact to our enrollments in the fall, which translate to our revenues in the fall, are going to be. So we have a lot of unknowns. Even though we may have solved part of our budget process, we have our problem. We now have another budget problem. Let me shift to the change in compensation, employee compensation. Those of you who are following the legislative process are aware that the legislature had approved a 2% CEC adjustment. We had been, however, they were not going to fund the entire amount of the fund shift or the amount of CEC associated with individuals who are not on appropriated lines, and we're not allowed to increase our tuition next year, which was the normal source for that funding. So we were looking at some sort of pool of 2% that could be spread across campus in essentially a 1 to 1.5% targeted increase. However, given the status of the state budget, we received notice in the last, I believe, 48 hours that the CEC plan will not be going forward. So there is no CEC adjustment for this year. Related to COVID-19, are there layoffs or furloughs planned? Specific to COVID-19, not layoffs. We do not have a furlough plan at this point, although one of the ways to solve some of the budget shortfall may be to institute a furlough plan. And certainly Admin Council will be talking about that in the coming weeks. Will parking passes be reimbursed during stay at home? There hasn't been a plan to do that at this point, but I certainly will take that under advisement, and we will look at the possibility of making an adjustment. However, I can't commit to anything at this point. Will there be hazard pay for essential personnel? We haven't had a discussion for hazard pay, and there hasn't been, hazard pay has not been designated for essential personnel by the Division of Human Resources, to my knowledge. In fact, we've been told to limit overtime or to not have overtime. What are the enrollment projections looking like related to COVID-19? That's the big question. I've been in contact with my counterparts around the country, and we are all guessing at this point. The good news for Idaho State University is I saw a report this morning, or heard a report from enrollment management, that our admissions are up 140%, or up 40% over last year at the same time. Now, we have to turn admits into attendees, but at least we have a good sign there. My counterparts around the country are hazarding guesses that enrollments may decrease by 5 to 20% next year. So we really don't know how that is going to play out, but we certainly have to be thinking about that as we look to the fall. So Rex, are you on with us?
I am.
Okay, so we're gonna talk about the CDC guidelines for essential personnel safety. I want to talk about this first bullet, and then I'm going to turn the rest of it over to Rex and Dr. Solbrig. So there's a question that I'm hearing a lot, because we have a lot of you who are on campus, and why are some staff essential and still reporting to campus? Essential staff was defined by the Division of Human Resources. Our campus is still open. We have to still maintain our campus. And so those of you who have been deemed essential were deemed essential by the state. And there are some jobs we just can't do from home. Custodial services can't be done from home. Maintaining the heat plant can't be done from home. Maintaining the technology labs or computer labs for our students, we can't do that from home either. So there are certain positions that were deemed essential, and what we are doing is our best in the area of social distancing to keep all of you safe. But with that, let me turn it over to Rex.
Well, thanks, Glenn. For those of you that don't know me, my name's Rex Force. I'm Vice President for Health Sciences, and I work with Glenn regularly at the admin council level and for all things related to budget in the Division of Health Sciences. Like Glenn, I appreciate all that all of you have done to keep the campus operating and to keep us functioning as faculty, staff, and administrators in some of the academic and clinical units on campus. I'm happy to answer questions about COVID and about the workplace. I'm happy to answer questions about our return to work plan, because we are actively working on a return to work plan, given all the uncertainty that's present in the community and with regard to the health of the public. It's difficult to put a specific timeline to that plan, but we're working on doing that. If people do have questions about COVID-19, about the workplace and workplace safety, about just general questions about the pandemic, you're welcome to send those questions through to Ginny, and I'll try to answer those. Dr. Solbrig is our Director of Health and family physician at our University Health Center, and if I can't answer questions, I can converse with him, and we can get back with you to get your answers, because he wasn't able to make it today. Just some general information about COVID. There are currently, I think, still reporting 8 cases in Bannock County, which is much lower than big chunks to the rest of the state, where there have been significant numbers of cases and community spread, significant numbers of deaths in some of those other areas. So in our part of the state, we are doing quite well in terms of the illness. But I will say, and I've had frequent conversations with our colleagues in the public health department, that we haven't done a lot of testing on this side of the state. A very, very small percentage of the total state's tests have been run in our area. And so we don't really have a very clear idea of the true number of positive cases in our community at the present time. We are looking at ramping up local testing to be able to better trace active cases as well as the contacts to those cases, because as we talk about opening up our society, our university, and our community, one of the very key elements of that is being able to test and identify those folks that are infected with COVID, and then being able to track the contacts of those folks that are positive. That's going to be a really important part of our being able to move forward with reopening the campus in particular. We do know that we're still under the governor's stay-at-home order until the end of this month, at which time that will be reassessed. I can tell you that there's not just going to be a a flip of a switch on May 1st and everything's going to go back to normal. It's going to take a lot of time. We had, I think, a very quick transition to working from home and working with essential personnel only, teaching online and that sort of thing. But the flip side of that is going to be a rather gradual reopening of campus and our communities to make sure that we're keeping the prevalence of the illness as low as possible. And this will really mean that even if we get a mandate from the governor to begin sort of opening our economy and our communities up again, it will still be sort of a titrated thing. That is, the most essential things first. We'll still maintain some social distancing. We'll still limit the large numbers of people that gather together. And that will occur for a long period of time, probably 4 to 8 weeks. If over that time we still do not see an increase in illness, then things will open up further over time. But the entire transition back to normal is likely to be a 4 to 12 or even 16-week process. So being fully back to normal by August is perhaps something that's possible. But if the illness sort of comes back and we have to have more social distancing implemented again, it would obviously be a setback to those kinds of timelines. Right now, the university is going to be teaching all of its summer courses that start in May online. And we'll be making the determination about what's going to happen for courses that start later in the summer, June and July timeframe. We're going to be making that decision in the next week or so as to whether they'll be online or live. My guess is, to be perfectly honest with you, that the entire summer will likely be online. But that doesn't mean that by August, if things go really, really well, that we might not be seeing a return to more normal work. That being said, this is a significant illness, and it is much more severe than influenza, which is, obviously we deal with that every year in this country. We have an influenza season from about October until March every year. That's why we recommend getting the flu vaccine. This illness causes death at least 10 times more commonly than influenza does. And particularly in those high-risk individuals, those people that have lung disease or heart disease or diabetes or other kinds of immune problems. Even obesity seems to be a risk factor for severe illness with COVID-19. We will probably have some criteria in place to gradually reintroduce people that have significant risk factors back into the workforce and coming back to work. So there are a lot of different factors that are going on to determine when we're going to return to work. We have a group working on the plans for doing that, but we will also be following public health guidance and statewide guidance for us to be able to move forward with a full return to work. I'm going to pause there and see if there are any questions that might come in to Jenny, or if there are other things that that Glenn or Trevor you'd like me to address.
Yeah, could you go real quick before the questions, Rex? Can you just hit the social distancing, cloth masks, and that guidance? Because we have a number of people that are on campus, and I think this is particularly important for them. It's important for everyone, but for those who are on campus.
Sure. So when we talk about social distancing at work, we want people to maintain a good distance when they're working together. So let's say a team is working with painting or doing other kinds of maintenance or working on an IT project or whatever the case may be. We want those folks to try to maintain at least a distance of 6 feet apart. We want those folks to also use masks. Masks not only protect yourself, but even more importantly, they protect the others around you. And we know that this virus can be transmitted by people who aren't showing symptoms yet. And we also know that some people show very, very mild symptoms that they may not even recognize as COVID. So we want to make sure that folks, if they're coming in relatively close contact with one another, that they should be wearing masks. That's a Centers for Disease Control, or CDC, guideline for them to do that. For people that are coming in contact with people that have suspected illness, and this could be public safety or other situations, much more, I guess, aggressive and protective gear is necessary, and that includes what we call N95 respirators, eye protection, and gowns to be able to, if we deal with somebody who is suspected of having COVID-19. In other situations, and including our medical clinics, usually what we're talking about is university health here, we also recommend that people are wearing gloves and masks in that setting. I will say that at our clinic, and this is the bullet point at the bottom of the slide here, University Health Clinic is seeing very few people that are ill. We're not seeing actual influenza. We're not even seeing bad colds right now, and that's partly because of the social distancing that everybody has done related to COVID-19. So there's I guess, a spillover effect of the social isolation that is in fact flattening the curve, as you probably heard, for COVID-19. It's also flattening the curve on other respiratory, as people aren't coming in contact with one another. But they are, if someone were to go into the clinic, they are handing out masks, and they want people to be protected and protect others with masks.
Thank you, Rex. So if there's questions, Rex will stay with us as long as he can, but he may not be able to stay for the whole meeting. If you have questions specifically for Rex, let's send those in. But at the same time, if you have other questions, by all means, start to send those into Ginny as well.
So Glenn, I'm going to cut in here. So I just added another document to the shared screen. EH&S has organized the CDC guidelines on PPE resources by the different essential personnel categories. And so this is a new resource that we're making available, particularly to supervisors. And so we're going to start distributing this guidance out. We just saw the summary that Rex walked through. And so we just want to reiterate that EHS, Rex's team, Ron Solberg, we have a team that are available to answer any questions, particularly on risk levels. And we did put together this guidance. And so we summarized all the information that the CDC has published, and we've geared it towards the essential personnel that we still have working on campus as a new additional campus resource to allow folks to be able to have as a reference point. And so as Rex shared, guidance right now is cloth mask coverings. As you saw on the slide, I know that there's a lot of homegrown masks being built within our units across the division. If there is some shortages still, EH&S will be able to distribute some. And so please signal with your supervisors, and supervisors take some current counts of if the team needs some cloth masks, we'll be able to distribute those. And so happy to answer more questions on this, as well as EH&S can step in and also answer.
Thank you, Trevor. So do we have some questions, Ginny?
We do. I'm going to try to ask the ones for Rex first. The first one is, let's see. Well, Trevor, I believe, answered this, but will ISU be providing employees with masks? And then next is there anyone that has had coronavirus from campus?
So we have had a couple of folks on the ISU campus, both here and in Meridian, who have tested positive. One student in Meridian was actually the first case in the state of Idaho. We did very aggressive contact tracing after that, and that person did not pass a case to any other member of the ISU community. On this campus, we have had, I think it was a graduate student that did test positive. That was several weeks ago. And again, we haven't seen any what we call community spread, that is spread from someone in the community without other risk factors such as travel, who have been infected. Yes, we have seen some cases in members of the campus community. The one on the Pocatello campus was actually well after campus was sort of closed down, and was unlikely to have spread to anybody else, and we haven't seen that documented.
And two other also for Rex. How long does it take to get the test back? And second question, what are respirators N95 anyway?
Okay. The testing has been highly variable in terms of the time to get a test back. The state is still running a lot of tests, and these are done through several different laboratories. So there's a state lab that runs some of the tests. We usually get a faster turnaround of maybe 2 days to 3 days from that lab. And commercial labs have been much longer. And in fact, when we were dealing with the case on the Meridian campus, we were waiting 10 days for test results to come back. That was earlier on when testing capacity wasn't as great as it is now. I think that the turnaround for tests typically is in the 2 to 5 day period right now. And we are going to start doing some community testing on the Pocatello campus in conjunction with the health department at Dyer Hall. This is going to be drive-up testing for people that have symptoms. It's likely to start later in the week, probably before the weekend, and will allow us to have a better idea of the numbers of cases in Southeast Idaho and Pocatello specifically. And we're going to be partnering with a company called Express Labs and the health department to do that drive-up testing here on campus. In that setting, people will literally drive up, and laboratory staff will go out and they will swab those individuals. They stick like a Q-tip all the way up into the nose or into the back of the throat, and then that's what they test for the virus. People don't even have to get out of their car, and then those results hopefully will be reported back in just a few days.
And then what are respirators N95?
An N95 respirator is a very tight-fitting mask. They look fairly similar to other masks, but they are fitted to the individual to make sure that there's a good seal on the face. And the N95 really is that's talking about the level of filtration that occurs through the filters that are present in the mask. These are not, I guess, as disposable as other single-use masks. They can be used, for example, all day. And because of the shortages of personal protective equipment, sometimes we've even seen in some locations that they are re-sterilizing these masks and using them again just because of the necessity to reuse the mask. So it's a bit of a more secure fitting, not permanent mask, but longer term use than a typical just flimsy surgical mask that many of you have seen in a doctor's office.
Okay. Follow up for the Express Lab Dyer Hall drive-up testing. Is there any chance that essential workers can get tested regardless of symptoms, since we know that not all carriers are symptomatic? How involved is ISU with Express Lab or SEIPH in this matter?
So we're very involved with Express Labs and Southeast Idaho Public Health. We have a working group that's been working together for several weeks to get this up and running. They will have criteria for testing. And so if you have questions about being tested, I think that it's reasonable to call University Health or the Southeast Idaho Public Health. They have a COVID hotline, and ask questions about that. Most of the times, I would imagine that they're not going to be testing people that are asymptomatic. We do recognize that some people can be asymptomatic, that is, not have symptoms of the illness, and can carry the illness. but most of the time, because the yield is so low for people that don't have symptoms, it's not cost effective to test everybody.
There's a couple of notes about referrals being needed for testing. Is a referral needed for testing, Rex?
I'm not aware of that workflow. I think the best thing to do would be call University Health or the hotline at Southeast Idaho Public Health and ask them about the criteria for testing. My guess is that if you call, if somebody has symptoms and they will ask you questions about those symptoms, they will then refer you down to that testing.
Okay. When we start returning to campus, will we be required to wear masks or other PPE?
So that depends. It depends on where we're working and under what conditions we're working. You know, most of the time, as we relax what we call mitigation efforts, that is the efforts to decrease the spread of the illness, once we get to those steps of relaxing that, we typically relax the PPE, that's personal protective equipment, those kinds of standards. So I think that as we get closer to opening fully, we would see a decreased use and requirements for PPE as we move along that pathway and timeline.
Okay, we're getting a couple of notes that the article in the journal said that you need a doctor's order for the test and the cost is $95 or insurance submittal. And
I did hear about I did hear about the $95 or being covered by your insurance. I think that they will have, you know, sort of some physicians or public health consultation available to be able to then refer patients down. And I say down because I'm thinking the public health department's up on the hill, but refer people over to Dyer Hall to have that testing done.
okay. What provisions do we have in place for employees who are high risk?
I assume that's meaning high risk for severe illness. And I think I said earlier that what we will probably do as we phase in implementation of a reopening plan, we would have contingencies in place to protect those employees and students from some of the you know, higher risk kind of activities. So for example, one of the things that we've been discussing is we may not have all of our classes go live again. We may even in the fall have some of those sections be online and have those be available for students that aren't comfortable being in the classroom with others, or for professors that are high risk for severe illness and aren't comfortable teaching a classroom full of, you know, 30 or 40 people. So we may make some exceptions like that as we work through the plan.
Do we still have
Sorry,
students?
I'm doing my talk with my phone because my internet's down at my house, and I realized that you guys were probably looking at my neck most of the time I was talking to you.
No worries. So do we still have students living on campus? How are they being protected if so?
So we do have a few students living on campus. The last number that I remember seeing was maybe from a day or two ago. We have about 28 students living in the dorms. We have over 200 living in the apartments, and we consider the apartments to be much lower risk than students living in the dorms and sharing facilities like bathroom facilities or being in you know, what we would call high density housing, like in Turner or even Rendezvous. So what we have done is we've spread students out throughout primarily Rendezvous so that they are still in the dorms. Many of these students don't have other places to go or didn't have the right kind of accommodations to continue their education. And so we invited them to stay, but we also have separated them the best that we can in Rendezvous primarily to limit the possibility of spread. You may have heard both University of Idaho and Boise State have had infections and spread within their dorms. We've been fortunate enough, and I think it's partly with the planning that we did early on, that we haven't had any illness in our dorms. Knock on wood, we still possibly could, but we have, I think, had aggressive mitigation efforts to prevent the spread in the dorms.
Do we have an authority to force student employees to wear a mask if they choose not to?
I think that's more of a policy issue that should be discussed at the departmental level. I think it depends on the kind of work that they're doing, the proximity that those students are to other workers. But I think there should be, in certain situations, a requirement for wearing personal protective equipment or masks because we're following CDC guidance. But I wouldn't say that we have to have just a blanket approval to force people to wear that. I think we should discuss it and the specifics of an individual situation before we set up those kinds of policies. And I don't know if Glenn or Trevor, some of those guidance documents you have might help with that kind of a question.
And actually, Brian, is there any issues if supervisors are telling their student employees they have to comply? I think Brian's on here. Thought I saw him. We will get back to your supervisors with that.
Okay, and that was the last health-related question. Oops, sorry, one more came in. Are there any contingency plans being developed should PPE supplies become depleted?
So we have done a lot of effort to collect all the PPE around campus, and Nancy Fox and her team at Environmental Health and Safety and Trevor Eagle have really been leading that effort with Chris Owens, who's in the Division of Health Sciences. They pulled together all of that equipment and they have inventoried it. The idea is that we would utilize that for our own healthcare providers and the employees, such as many of you that need to use that kind of equipment in certain situations. So we have a reasonable stock of that at the present time. We have not been overrun with cases in the community, and one of the reasons we were collecting it was in case the community was running out of that kind of equipment. We haven't had a lot of requests to utilize that equipment in the community yet. So we're hopeful that we would have enough, unless we see a really big surge in cases. I think we'll be okay with our PPE. I think the supply chains are also opening up a little bit for PPE. So I'm not anticipating major problems unless we have a real surge in illness and we have a lot of sickness in the hospital and potentially in nursing homes and that kind of thing, where that would consume the PPE very, very quickly. But I think we're in reasonably good shape on campus at this point in time.
Will there be the possibility for those who can and who want to continue to work remotely even after we return to normal? Is the administration willing to encourage flexibility for that possibility?
So I don't think we've really addressed that if we're in a true normal kind of situation. My guess is that if we really get back to that point, which, as I said, could be as much as several months down the line, that we would be back to normal. And you know, I think telecommuting is possible for some individuals. I think that looking at the risk factors of those individuals is going to be important. That is, some folks are more likely to develop serious illness than others. They may be put in situations where they're coming in contact with other individuals to a greater extent, you know, such as a cashier, for example, or somebody who is dealing with the public face-to-face a lot all day long. But we don't have policies developed if we're truly back to normal, whether folks are going to be allowed to continue to telecommute.
And I can say for the division that as we work through our executive team, as always, I would encourage our executive team to be as flexible as possible with the employee work location, with the employees in their work group.
Okay. Sorry, scrolling here. This person's son told him that some of his friends have been accepted into ISU for the fall, and we're told in an email that fall classes will probably be online. Is this true?
No decision has been made about fall classes at this point. In fact, the only decision about moving classes to all online are for those that are starting in May. Is that right, Rex?
That's right.
The first two summer sessions, but the final summer session, the decision hasn't been made yet officially to move those to online. So, we have the Emergency Operations Center team that Chris Boyce and our group heads up had been meeting, well, at one point we met twice a day, at the beginning and the end of the day, every day, and the weekends. And then it moved to just the mornings, 5 days a week. I think we're down to 3 days a week now. And in those meetings, there are probably an average of 25 various campus leaders representing different areas involved. And we are wrestling with these issues throughout the week. This is a very fluid environment, as you're aware. And so we are making decisions. We're trying to take, is it Elsa or Anna's statement to do the next right thing is what we're trying to do.
That is all the questions we have at the moment. And I believe Nancy Fox can answer questions about cloth masks, FYI. I know she and I are on a subcommittee working on that.
Now the 4 o'clock group, you usually have more questions than the morning group, and you usually go to the full limit, and we still have about 8 minutes. I miss not seeing your faces in person, and just looking at names with a lot of you, but I realize that with the number of people we have on campus, there is a heightened awareness of PPE and protective related questions. And so that's why we spent most of the time on that. But at the same time, having sat in on some of these town halls and other areas across campus, there have been other questions that have been brought forward. So you have my attention.
Is there anything we are doing to prepare for future epidemic situations beyond our current crisis?
Well, I think the one thing that's coming out of this is, well, first of all, Lewis and Chris had done a great job of helping the campus get ready for our continuity plans and our emergency planning plans. Certainly, they didn't necessarily anticipate a prolonged pandemic, but through this process, I believe that Chris is in a position to help us refine those plans, and the questions and policy decisions we're making now, I think we will be in a better case. I mean, this is like a prolonged tabletop or day-long practice session, and so I think we'll be creating processes and procedures based on what we've learned in this to improve our process. Chris, did you want to say anything about that? Or Lewis?
This is Chris Boyce. No, I think you're 100% right. We learn from the past, and we prepare for the future, and we will be prepared for the next pandemic, but the next pandemic will not be like this pandemic. So I think what is shown is just the power of, we constantly are talking about carrying flexible and creative and continuing to move forward and evolving our emergency management plan. And it's not just a plan, but it's the preparedness of our community. And it's also the training and the exercising of our plan to make sure we know how to respond to whatever our campus faces, whether it's weather, pandemic, or some other sort of event. But that's what we're after, and we'll continue to move forward with this for the lessons learned. So thank you.
Thank you, Chris.
Okay. Glenn, could you repeat what you said about furloughs, please?
Yes, we currently do not have a furlough plan. Furloughs are one of many things we can do to address some of the fiscal challenges we may have in the coming months. The president has asked me to prepare some numbers for him. He and I have had a few discussions, but they've simply been exploratory at this point in time. We shared with Leadership Council today. He shared his belief that if and when you do furloughs, that that ideally it should be a tiered type and structure, meaning the higher paid employees take more days than the lower paid employees. Not that it's the same amount of days across the board. But that's just what he has shared with us, his initial thoughts. But as far as any protracted discussions at Leadership Council and Admin Council, we have not had those yet at this point in time. That's not to say that we won't develop a plan for next year as one of many many tools we may have to use as a community to get through this fiscal crisis.
Follow-up question to that. Have you considered voluntary furloughs for folks making more than a certain amount per year?
We have not had any of the furlough discussions at this point in time. Again, at the leadership council or admin council, certainly I can bring forward the idea for potential for voluntary, allowing voluntary furloughs or people to voluntarily take some time. But it's a little bit premature for me to give you any definite response because we haven't come up with a plan. Certainly if we come up with a plan and ready to put it in place, I'll be able to answer specific questions as to what that means for each of us.
Okay. And Glenn, what is the process for submitting a cost savings or efficiency proposal?
I believe if you go to the budget website, we still have a link that is open to submit ideas. And if you can't find that link, you can send it directly to me or to Jen Steele or finance@isu.edu.
Are the hours going to be reduced for essential employees if this continues?
There are no plans at this point in time for either hour reductions or a furlough. And that's all I can say at this point. There are no plans, nor have there been discussions to have reduced hours.
Is discussing hazard pay, especially for essential employees, going to be something that is going to be a priority?
I will bring the hazard pay issue and question to the next admin council meeting that I have. And I will respond to you all when I get a response.
Okay, I believe that's all we have right now.
Okay, well, thank you again. I'm sorry we have to meet in this circumstance, but I guess this has been kind of a new normal for us. Hopefully it won't last months and months. Hopefully it's a matter of weeks that we can all get back together again. So.
Glenn, do we have time for one more?
Yes, then I have to drop off for admin council.
Okay. Will there be reimbursement of sick days / vacation days for at-risk essential employees that were told to use them to comply with the stay-at-home order?
I don't have an answer for that. Brian Sagendorf, can you weigh in on that?
I think I heard the question, if I heard it right, was if somebody had to stay home and they needed to revise any time reporting, but could you reread that to me?
Absolutely. Will there be reimbursement of sick days / vacation days for at-risk essential employees that were told to use them to comply with the stay-at-home order?
So the state and the federal government have issued some new leave programs in terms of emergency family medical leave and things of that nature. So if an employee needed to stay home, for example, to care for children or teach children because a school was closed or a daycare was closed, there are some new federal leave programs to address some of those items. So if somebody used sick leave or vacation leave, and now given the circumstances of that, they need to explore adjusting that, please contact payroll. And the payroll office and HR team recently sent out some instructions, a checklist of things to go through in reporting time under the new leave programs. So if any adjustments need to be made, since April 1st is when those new leave programs went into place. So if there's any adjustments that need to be made, please contact payroll, and we can work through that.
I think you're muted, Glenn. Sorry.
Thank you for your response, Brian. I did have one question. Could you go back and read that again, Jenny?
The last question?
Yeah.
You bet. Will there be reimbursement of sick days / vacation days for at-risk essential employees that were told to use them to comply with the stay-at-home order?
I'm not aware of situations where we told people to stay at home, but I believe what I'm hearing the question is really if you were an at-risk, if the person was an at-risk employee, and because of the stay-at-home order, they chose to stay at home. I believe that is what I'm hearing. If that's not the case, if they could just let you know, I'd appreciate that.
That is the case.
Okay. Okay. That just helps. I didn't have the entire premise. I wanted to make sure that we didn't have anyone going rogue, running around telling people they had to go home.
Yeah.
But I am glad that we have supervisors who are compassionate and concerned enough about our employees to allow them to work from home, particularly those who are at risk.
Okay, and Glenn, you could take this offline. I know you're late for your meeting. The last question, if you want to address to everybody next time or in an email, have there been layoffs considered for budget reform?
In looking at next year's budget, as we were trying to, as our executive team was looking at ways for us to cut 4, 5, or 6% from our budget and for us to reorganize, we have identified different areas that may result in downsizing. That's still under consideration. The way the budget process is working right now is Leadership Council is working this week to come up with a recommendation to Admin Council. Admin Council will spend the next couple of weeks formulating what our budget is for next year. I think it is safe to say that within our division, there will be fewer employees next year than we have this year because we have to solve a budget problem. But there will not be widespread layoffs. But we will be going down a number of individuals, a number of positions. My hope is that most of the positions will be going down are currently vacancies that we will be permanently giving up, but there'll be more to come. I know it's better to have some information than no information, and the way the rumor mill works, so it's better to have some. And so I would just, I'm cautiously, or I'm asking you just to be cautious and judicious in taking my statement. There is a non-renewal date for non-classified employees, which is Monday, April 27th. And so to my knowledge, most of the the employees who are classified, whose positions are going away, have been notified. But I can't give you 100% on that.
Thanks, Glenn.
Thank you. I appreciate all of you taking time out at the end of the day for this. And you're welcome to come to the one at 10 o'clock tonight as well, to have a different face than my normal group that I meet with at 10 o'clock when I do these, or again tomorrow. It is the same information, but there may be different questions. So it's up to you. You're more than welcome to attend both or all three. All right, goodbye. I have to run. Thank you and goodbye.